Transport of the critically ill. At the end of this lecture, you should be able to decide whether the transport of a critically ill patient from the ICU is appropriate, explain the preparation of a patient being transported from the ICU, and predict problems that can occur transporting a patient outside of the hospital setting. You've been asked to transport a patient with severe multiple trauma. How would you approach this task? Have a think about it for a minute. The first thing is to determine whether the transfer is indicated. Indications for transport of a critically ill patient outside the ICU include transfer to a facility that can provide a better level of care and transfer to and from diagnostic facilities to allow better management of the patient's condition. It is important to weigh up the risks and benefits of the transport. Risks will be dependent on where the patient is being transported to, how long he or she will be out of the ICU, the environment to which the patient is being transported. For example, it is difficult to resuscitate a patient while he or she is in an MRI scanner, your skills, and the patient's condition. Where to may be in order of increasing risk: intra-hospital, inter-hospital, or even international. How long the patient will be out of the ICU depends on where they are being transferred to and the duration of any procedure. For example, the time will generally be much shorter if the patient is being transferred for a CT scan than for angiography. When considering the environment, consider the lighting, proximity to the ICU, access to the patient, and any difficulties posed by special environments such as MRI, helicopters, and ambulances. In determining the risk posed by the patient's condition, consider the ABCs, as well as the degree of organ support required, and the reserve, both physiological and therapeutic. How much more can the vasopressors or FiO2 be increased by, for example? ICU is a team-based specialty. During a transport, the team is very small, usually one doctor, one nurse, and a porter for intra-hospital transfer. Do you have the skills necessary to resuscitate the patient until help arrives? Does the team need to be bigger? In planning the transfer, it's important to anticipate predictable requirements as well as complications. Aim to minimize the time outside the ICU by knowing where you're going to and how to get there, and checking that the receiving unit is ready before you leave. Check the patient's history, stability, ABCs, and drains and lines, and make sure that he or she is appropriately restrained and protected. Consider what equipment you will need. This should be checked against your unit's checklist. Check that the equipment works, that you have backup for vital equipment, and the battery will last for the journey with additional time in reserve in case of unanticipated delays. And make sure you know how it works. In essence, what you're aiming for in terms of equipment is a mini mobile ICU. Check what drugs you should take against a checklist and determine what drugs you want already drawn up. and what you want as a standby. Make sure you have an adequate stock for the journey. Documentation is vital to continuity of care, so make sure you take relevant notes, x-rays, and completed consent forms. All of this is too much to remember, so use checklists to help you. Given the difficulties of resuscitation during transport, it is vital that all transport team members have clearly defined roles and that all staff are adequately trained. Think also about how you're going to get help if you need it. A mobile phone may be invaluable. Think about the transport itself. What mode of transport you're going to use, and is the mode associated with specific problems? What are the traffic and weather conditions like? Will the bed and the equipment fit in the lifts that you plan to use? Finally, before you leave, recheck the ABCs and repeat an arterial blood gas. Moving the patient from bed to stretcher or bed to bed requires special consideration. The transport team leader should maintain charge of the movement process and give clear instructions as to readiness and timing of movement. For example, an instruction to move on the count of 3. Someone, usually someone with advanced airway skills, should be designated to control the patient's head, airway, and ventilator circuit. At your destination, try to anticipate the effect of investigations or procedures on your patient. If transporting the patient to another ICU, check the patient's stability and stay to help resuscitate the patient if necessary. Remember that it is very difficult for the staff in the receiving ICU to resuscitate a patient they know little about. When the patient is stable, give a comprehensive handover. Now I want you to write down 3 learning points from the lecture. 3 things you think would be important to tell a colleague who has not heard the lecture. I'll give you a minute to do this. In summary, before transporting a critically ill patient, consider the risk to benefit ratio carefully. The transport should be carefully planned, and as there is a lot to remember, use standardized checklists with appropriate additions as necessary. The aim is to provide a level of care which is as close to care within the ICU as possible.